We have participants from different parts of the world at this webinar, so I would like to begin by acknowledging all First Peoples here today and pay my respects to them and to their forebears. We honor your wisdom and your stewardship of traditional lands and seas, and your customs which enrich us all. I'm Dr. Maggie Hardy, Executive Director in the Office of Licensing and Compliance at the Australian Pesticides and Veterinary Medicines Authority, and I'm very pleased to be a new member of the New South Wales chapter of the NRCOP. On behalf of ANZSOG and the NRCOP, I'm delighted to welcome you to the NRCOP's 10th webinar for 2021. Before I introduce our speakers, some brief housekeeping. To our regular viewers, you'll be familiar with how we run the webinars. But for anyone joining us for the first time today, or for any of your colleagues who might have missed today's webinar, all of the webinars are recorded and will be made available on the ANZSOG YouTube channel within about 14 days, so you can jump online and watch all the webinars from last year, and the 9 already completed for this year. We'll be using the free sly.do app for your questions and comments. On your phone or device, enter sli.do into your browser, and then #safety is your event code. You can start asking questions immediately, or if you like the look of another question, you can upvote that question. It's now my privilege to briefly introduce our two panelists for today, Professor Sydney Dekker and Martin Campbell. Sydney Dekker is a professor at Griffith University in Brisbane, where he runs the Safety Science Innovation Lab. Sydney has won worldwide acclaim for his groundbreaking work in human factors and safety. He coined the term safety differently in 2012, which has since become a movement. Sydney is the best-selling author of, most recently, Foundations of Safety Science, The Safety Anarchist, The End of Heaven, Just Culture, Safety Differently, The Field Guide to Understanding Human Error, Second Victim, Drift into Failure, and Patient Safety. Welcome, Sydney. Martin Campbell is the Work Health and Safety Regulator for South Australia and the convener of the soon-to-be-launched South Australian chapter of the NRCOP. He has 30 years' experience working in regulatory compliance and investigation at senior executive levels in the United Kingdom and Australia. Initially a senior detective in the United Kingdom Police, working on national homicide training and development, he later qualified in law, working in the field of regulatory compliance and risk in health and safety, working in Papua New Guinea, Indonesia, Brunei, Malaysia, Hong Kong, Kuala Lumpur, Fiji, and Singapore. Welcome, Martin. Today's session will run along the following lines. I'm going to draw upon my previous life at the Centers for Disease Control and Prevention, Atlanta, Georgia, to talk briefly about regulation as communicating the cost of nothing happening, which turns out to be very timely at this moment. Sydney, guru of Safety Differently, will talk to us about a philosophy of safety, which flips us from avoiding failure to learning from success. Martin will then take us through his journey to doing safety differently as a work health and safety regulator, after which I'll open it up to you, our audience, to ask some questions. A quick reminder that we're using the Slido platform for questions and comments, and the code is #safety. If you're eager to participate, you can submit your questions right away. The first step in communicating risk and hazard is defining the message. To define the message, you need to determine what information is needed for making decisions. There should also be consideration of policy settings like risk appetite and risk tolerance. Risk is also relative, and I think Australians are uniquely poised to understand risk. For example, what one person considers an extreme risk could be a day at the beach for another. In most cases, risk assessment requires an estimation of exposure. The image on the right hand of the slide is one example of clear communication about these risks and outlines the risk of fire danger in different seasons across Australia. After you define your message, the next step is getting the message out. As the great American philosopher Yogi Berra said, if you don't know where you're going, you'll end up someplace else. Crisis and emergency risk communication is a lot like that. The CDC approach is that the right message from the right person at the right time can save lives. The 6 principles that underpin this are explained in the graphic alongside, namely, be first, be right, be credible, express empathy, promote action, and show respect. When talking about crises and emergency risk communication, there are generally 2 outcomes you want to achieve, either to alert people or to reassure them. The figure on this slide shows 4 different quadrants, depending on whether outrage or hazard, or both, are increasing. When outrage is low but the hazard is high, the message is to watch out. to alert people that there is a risk. When outrage is high, but the hazard is low, the message is calm down, to let people know that the risk is low. And now it's my pleasure to welcome Professor Sidney Dekker.
It is a supreme delight to be able to talk with you and Maggie live at an event like this, and with all of the colleagues on the line. So, hey, Mark, if it's okay with you, what I'll do really quickly is just run through a few ideas about safety differently, boom, 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 as Maggie said, and then, but I will connect them intimately to the theme that you and I do need to tackle today, which is, so what is the source of this sense of overregulation when it comes to safety bureaucratization today? And what can we together as a community find levers, right, to try to wiggle ourselves out of these constraints that we've sort of imposed? The question why safety differently is relevant for today is this, that increasing compliance doesn't seem to yield greater safety returns anymore. And in fact, there may be some evidence that it's working against us. There are many reasons for this, obviously, but one is, of course, the sheer complexity of the world, right? The world is not so easily fooled. We can always write more rules. Absolutely, we can, and we do, but it actually has stopped yielding more safety. This seems to be a natural function of an increasing safety level. René Alberti has done the work on this, right? If you're 10 to the -1, kill a lot of people, then actually writing more rules makes you safer. Yes, but if you're 10 to the -5, -6, none of that helps anymore, right? These systems are already overclogged with rules, and they're purely additive, as René says. You're purely additive. More rules just means more rules. It doesn't mean more safety, right? So one of the suggestions, part in jest, but part seriously, is every time you write one new rule, another rule has to go, right? So at least make it sort of rule neutral, but what is a rule? Where does one end and the other begin? Anyway. So those are discussions that are almost sort of too tiny to be relevant today. But this is the main issue. Of course, Deloitte, and I'll refer to this in a second, did a great report a few years back showing that the rise of compliance workers in Australia has been quite dramatic, but that the increase in safety in terms of particularly fatalities across industries has not matched this rise at all. So we throw about double the amount of compliance at the problem compared to 20 years ago, yet the fatality rate in most industries has been pretty constant throughout. And so, you can say, oh, our TRIFR is better. Yeah, right, because we know how to manage and manipulate and fraudulently case manage these numbers to make them look good. Sure, that will never impress me, except the levels of creativity that go into doing that, but not the outcome. So more compliance does not equal more safety. So it seems like an interesting and in some sense necessary impasse for us to consider. If more bureaucracy is not yielding the result we want, why do we keep reverting to more bureaucracy as the answer? Right. Well, let's have one more rule. It will make a difference. This one rule. Instead of the marginal return, or us realizing that the marginal return of every additional rule or piece of compliance is not helping, we seem to be wedded to this belief that one more tiny little bit, as in the meaning of life, one little chocolate bit in the mouth of this rather large man, boom. It will make a difference. No, it won't. It'll just create one more rule, right? Purely additive, to go back to René Alberti's work. Here's a great example, and it's in fact a great example in all kinds of ways. A how to sit at your desk checklist, right? Which even my university now applies. And you go, oh my God, this thing costs 20 minutes. The organization that did this then went to hot desking, so you have to do the bloody thing every day if you want to be fully compliant, right? 20 minutes, gone. We wonder why Australians are becoming less compliant. Less productive, right? Well, and less compliant, I suppose. But of course, this is in the construction industry, this particular one, which kills about 60,000 people a year. How many of those behind the desk, right? Now, Martin, I would go back to you and say, did you ask these guys to have a how to sit at your desk checklist? And your answer is no, you haven't asked them to do this at all. The problem is markets, money, insurance, right? Workers' compensation, things like that, right? And companies say, oh, let me find a way to not pay for this when people, get lower back pain. And so, well, but you did the checklist, you have signed that everything was all right, and your manager has signed it. So, don't come back to us now. which is not a discussion we should be having at the level of the sharp-end people sitting at desks. It's a discussion we should be having as a society. Is this a smart way to think about how to manage the risks of these injuries, right? To fork this out to private companies, sorting out who gets to pay for what. And this is, of course, the problem with markets, right? Since the 1990s, deregulation, neoliberalism, markets taking over, markets being the solution to everything. Well, if markets are the solution to everything, then everything gets a price, because otherwise markets don't work. If everything gets a price, everything needs to be accounted for. If everything needs to be accounted for, you need processes for that. If everything needs to be accounted for, you will get all kinds of energies running through the system trying to avoid being accountable because you don't want to pay, make someone else pay. This is a great example of just that, right? And so it has very little to do with safety, but it is compliance driven by the marketization of many industries. Now, you see the same in healthcare, right? Jeff Braithwaite down at Macquarie, great little piece of research, which says, how many policies does this nurse need to follow every day? 600. All right, so that's quite a few policies, by the way, right? Now, how many can the nurse recite back to you? Between 2 and 3. If ever there was any evidence for Eric Holnagel's difference between work is imagined versus work is done. Voila, right? 600 policies, 597 of them are utterly irrelevant, not known, just, to doing work, because I'm here to take care of patients, right? Not to follow policies. There's even policies how to stack dishes in the break room. Really? How to heat food in the microwave. Really? And people spend time on this nonsense, right? So yes, otherwise we have safety concerns. So Deloitte was pushed to saying, get out of your own way, you silly Australians. You're making life so miserably difficult for yourself. What they showed in this report was that 40% of the bureaucracy that we're experiencing in safety today is imposed by government. You go, okay, fair. 60% is we made it up ourselves. We impose it on ourselves, all right? Now, it was based on this report that I went, hang on, there's a really interesting question that we need to pursue there. So there's the new book, and that's the answer to the question that actually this report gave rise to. Where does this 60% come from, right? Why do we, and so healthcare actually imposes like 85% of itself, right? So in other fields, you're in finance, it's like 80%. It's an astounding amount of bureaucracy and compliance is self-imposed. But what does self-imposed mean? Where does it all come from? So this book, which will come out in a few weeks, you can pre-order, but it's okay. I by the time you've read it, I've probably written the next one, so it doesn't matter. But privatization, deregulation are very important components in this. Financialization and short-termism, the fact that we need to report quarterly has an enormous consequence, even for safety reporting, because you need numbers that make you look good, otherwise your share price hurts. A condition that we started calling auditism, I love that word, the idea that auditing becomes an activity that is consistent only with itself, right? Just like math, it produces results that is consistent with its own language, and it asks people to present their world in a way that makes it auditable, right? And so safety management systems typically do that. But even the physical worlds that we get auditors in, we make those worlds auditable for those auditors. And so it becomes consistent only with itself. And, leads to an interesting question, which is, when was the last time that you were really surprised by an audit finding? Right? Well, I can't remember what, but deprofessionalization, very important trend that adds to this as well. Declining participatory equality, right? Less unionization, so there's less pushback and power, although unions do in this country have an interesting and sort of conflicted or ambivalent role in the creation and celebration and leveraging of safety bureaucracy, even for their own ends. So there is a duality in that for sure. As Deloitte showed, a growth of the compliance workforce, new surveillance technologies that then require complete back office in order to do all kinds of things with the data, right? Just think about intelligent vehicle monitoring systems, right? The data trace left by every little drive of your employees is huge, right? You need to do something with that, which calls for bureaucracy, rules, red lines, flags, all kinds of things, right? So market concentration tends to create bigger companies. Bigger companies are necessarily more bureaucratic, if you remember Mintzberg's work from the 1970s, right? So that's almost lawful in science. And as I suggested before, there is a new market for safety bureaucracy. Just some numbers from Andrew Townsend, who ran through this, and then he passed away, unfortunately. But he was tracing these things. So the number of safety professionals in Australia, right? 95, it was 7,500, and 2014, right? So 20 years later, it was 30,000. You go, wow, that's like a fourfold increase. Where are they all? Well, you may be some of them, who knows? But did we increase safety by fourfold? You know, so we did certainly increase safety bureaucracy by fourfold, right? Or as Dave Proven beautifully calls it, the work of safety, not the safety of work, right? So we're certainly improving the work of safety, but not the safety of work. Even worldwide, you see the same thing. In 3 years alone, doubling of the number of safety companies working in this market, right? Creating more rules and stuff for others to deal with. So what we always need to remember, of course, is the difference between work as imagined, work as done, right? In all of this. And I think, Martin, that really leads to the discussion that we need to have about this, which is if and this is Eric Holden's distinction from 2012. Here's just never mind those guys. There's a great example from just south of here, a university project that we did on the sewerage work that these guys were doing. This one, the boss is watching. Everybody is working according to rules. Not much work's going on. It's going pretty slowly, as usual. You know, you put formal audit pressure on the system and it slows down immediately. I think the questions that we need to ask, Mark, are, you know, not why are you violating? Why are you not compliant? No, we need to understand, as Maggie clearly suggested, help me understand why this makes more sense, right? And don't ask who's responsible for doing this. No, what is responsible for putting you in this position, right? What are the capacities that we are not allowing you to put on display? What are we holding back? What are the constraints that we are putting on you? And certainly, I think it'd be a useless question to ask. So, what should the consequences be, right, when you do this? No, it's. I think we should ask the following question, which is, what's the stupidest thing that we're asking you to comply with, right? What's the stupidest thing? And so, if you really want to make that shift to safety differently, right, remember the Gaussian, right? This curve, this normal curve of the distribution of work, right? On the left of the curve, things go badly, incidents, right? And so it doesn't look good at all. Then there's a lot of white space, increasingly moving to the right, going to the sort of the heroic recoveries, the Hudson River landings, you know. And so, but in between, there's all this stuff, this normal work going well normally, right? And it's supremely under-investigated. And you could come back and say, oh, this is where people are compliant. In the red bit that they're not compliant. Well, first of all, that would be utterly inconsistent with the idea of a Gaussian curve, right? Because, you know, if you want to make the argument that fully compliant work happens, you know, in the mean, then there's lots of deviations from the mean in which it isn't fully compliant somehow, right? The Hudson River landing being a great example, by the way. So even the airplane wasn't fully compliant. The geese weren't, but anyway. So if you consider this white space, as Eric also beautifully reminds us, right? So much goes well, so much work goes well, right? And we focus on getting people to comply to stay out of the red bit. Nonsense, right? So now, before any of these discussions, this was in the mid-2000s, I'm working in this hospital. Canada is the last example, and then I'll give it back to Martin. 1 in 13 patients get hurt. And you go, that's a lot of patients. Actually, it isn't. For a hospital, this is very safe, right? So 1 in 13. And so we asked, so what are the causes of this? Well, we have our root cause analysis, which is a crappy method, by the way, but you know, they use this as healthcare does. And they go, oh, these are the things that we keep finding. People violate the rules, right? They're non-compliant. They make shortcuts. They do workarounds. They don't follow guide. I mean, there's all this non-compliance. And there's some other things. They don't have math skills and all of that, right? So, and they hit their supervisor. You know, nothing new, right? You go, okay, so what are you doing about it? Well, we put up some posters. That's always a bad idea, because all posters do is try, you know, they tell other people to try a little harder. You know, that's what posters do. You know, independent of what you put on them, that's basically what they say. Try a little harder, stare more aggressively, intervene quicker, you know, care more, then everything will be okay. And so these interventions didn't work at all because they were still at 1 in 13. So then we asked the proto-irritable Megalian question, which is, well, what about the other 12? What do you mean the other 12? Well, the ones that go well. 12 patients go out well, 1 is dead or is injured. So what about the other 12? They go, we don't know. So we went in, studied this for weeks, and found out that in the 12 that go well, the same stuff is there. Doesn't matter, right? People don't comply, and they go well. So you go back to the nurse, 600 policies. She can't recite 597 of them. Of course, people don't comply. I mean, how can you comply with 600 policies, right? I mean, you can't get any work done. In fact, I was talking to an ICU doc in Texas the other week, and she said that if she wants to, she's able to fill her 8-hour shift with about 11 hours of compliance work. And I said, well, what about patients? Yeah, no, that's incidental. That needs to come outside of that, because during my 8-hour shift, I can do 11 hours of compliance and paperwork, right? So, which is fascinating, So clearly the equation doesn't compute, right? So of course people don't comply. But then, back to what Maggie was saying, and this whole idea around safety differently, safety two, is what are the capacities that actually make the difference, right? Because in the 12 that go well, what we started finding was that there's more diversity. People keep a discussion about risk alive. They don't take past success as a guarantee. They have the ability, genuine ability, to say stop, right? Legitimated and empowered by the organization, by leadership. They defer to expertise, right? They rely on people who know rather than those who are supposedly in charge. They don't wait for audits or inspections, right? They improve stuff along the way. There's a pride of workmanship, right? It's those sort of capacities that make the main difference. So that is the sort of prototypical research that inspired this whole thinking around safety differently.
Always entertaining, always great to listen to Sydney and his ideas. And when I came to the regulator, I was really aware very early on that we were driving a particular type of behaviour, and generally in safety inspectors and maybe other jurisdictions more broadly, generally when they go onto sites or an incident happens or somebody gets hurt, one of the first things an inspector asks for is, where's your procedure for that? Now, so when you're on the receiving end of being regulated and that's the question that's going to come, guess what you're going to do? You're going to write a procedure to give to the regulator, and the quality and content of that will be really irrelevant because it's just there to give to the regulator. And quite often the regulators aren't experts in that area, so even if it's the best written procedure in the world, it might not mean a lot to the inspector who receives it. But generally that's what we'll go against, and we'll look at it and say, well, has the worker, has the people involved complied with what's written in this procedure? And we'll take some compliance action in accordance with that. And I'm trying to rationalize it in my own head as to why we operate in that way as a regulator. We're driving a particular type of behaviour. Sydney mentioned at the start about having all of these procedures around the place and generally written by people who don't know what to do in that job anyway, and then forcing workers to work within it. And then you wonder why when people aren't looking, they immediately turn to an easier, more efficient way or quicker way to do it. So I started talking to my guys at Safe Work SA around safety differently and the concepts of decluttering paperwork that doesn't add value to safety, looking at the work of safety, not the safety of work, and vice versa. And what I realized very quickly is nearly everyone in our organization hadn't heard of it. It was a really new concept. There was a couple who had, and those people who had generally been recently studied some postgraduate qualifications, but the vast majority of people didn't. And then I started broadening this discussion around the country and realized that other regulators were regulating in the same way. And I thought, wow, as a regulatory industry, we're really driving a particular behavior here, which is forcing organizations to increase bureaucracy and paperwork that doesn't necessarily add value to safety. And that was the challenge for me, is how do we actually change that perception, change the way we operate? And don't get me wrong, this is not really finished by a long way, and it's not an easy thing to change. We're trying to sort of break and change a whole sort of decades worth of regulatory culture here to get people to think differently. But when I go back to the work health and safety legislation we have in South Australia, which is sort of models the rest of the country pretty much except Victoria, there are only about 4 things in that legislation that requires documentation. So you don't actually have to write everything down. There are other ways to do it. And some of the ways to regulate those concepts might be a little bit more challenging, and you'll have to ask different questions than where's your procedure. And it might require people to get out of the office and go to site and actually speak to people and observe work being done and talk about risk and talk about controls, but talk about them with people on the ground who are actually doing the work rather than the safety officer who generally isn't an expert in anything but sits and writes procedures and tells people how to do their job. So for me, that's the journey that we've been on, is to try to sort of ventilate these new concepts to remove the regulatory burden, or at least ease it in a lot of ways, and sort of help organisations still comply with the legislation, but do it in a meaningful way that actually adds value to the work that they're doing, rather than just creating a little cottage industry within an organisation to create volumes of paperwork that nobody reads. And I think as a regulator, a safety regulator, you could really sort of remove the word safety and impose any of your own jurisdictions in there. It could be environment regulator, fair trading, tax. It's just an opportunity for us to reflect.
Well, thank you so much, both Sydney and Martin. Audience, it's now your turn to ask some questions. And I can see you've been very active on the Slido app during the presentations. And a reminder, if you missed it, our hashtag is safety. The first question, I think, is from Sydney. Should we have defined safety first? Is it the absence of undesired outcomes or the presence of things going well?
It depends on how dogmatic you want to be. But thank you for the question. So I've had these discussions about Eric, right? And the question is safety differently still safety one in terms of wanting to avoid bad outcomes? Right, as a pilot, avoiding bad outcomes is a good idea, right? I mean, when you drive a big jet, you know, with 200 people on your tail, you will be the first at the scene of the accident because you're riding up front the damn thing, right? So avoiding bad outcomes, I think, is still a good idea. Scientifically, though, what I know very well is that focusing most or all of our regulatory efforts on that activity misses the point completely, because, as I said in the intro, in a complex world we get outwitted very quickly, right? Meeting complexity cannot be done by compliance. Only Newtonian, simple, predictable, linear worlds can be managed by sheer compliance, by writing equation sets and algorithms, whether in checklists, procedures, policies, because essentially, you know, they are equation sets. Follow the equation set, you'll get a good outcome. That's really nice and cute, but that doesn't work in a complex world, right? And so in a complex world, you can meet the changing, dynamic, fluctuating, varying face of risk only by instilling capacities in people that render them resilient, right? Able to foresee and anticipate and adopt and absorb these harmful influences that might come their way.
Martin, this one is for you. Would you suggest that a better way forward would be to have framework type procedures instead of prescriptive task controlling procedures?
My personal view is most definitely. So I think we should allow people parameters to work within with a task, because tasks very rarely stay the same ever. And they'll always change depending on the weather, the environment, who's doing it, how they're doing it, the tools that's available, the condition of the thing that you're touching. So to write a prescriptive step-by-step procedure really is setting people up, from my perspective, you're setting people up to fail, because you're never going to be able to replicate the environment every single time. So you would train and you would support your people to work within parameters to get the work done and allow them to use their expertise and their guidance. And I think as a regulator, I think there's a perception out there that organisations have to remove every sort of risk and every sort of hazard, so that people don't cut themselves, don't nip the skin, don't pinch fingers and that sort of thing. And whilst that aspiration might be fantastic, the reality is like zero. I haven't yet come across an organization that has a zero incident rate or zero injury frequency.
Only those who are really good at the fraudulent manipulation of their numbers.
Exactly. So you're right. I think people have to be tolerant of risk, and they've got to accept mistakes. The important thing for me when I talk to my inspectors and organisations is, well, what have you learned from those mistakes, and what are you changing? What are you doing better? And also, what are you learning from when things go right? Why aren't you investigating those things?
Nice.
Not just a case of investigating when things go wrong. And then even the investigation process itself is getting people to actually drill down to a meaningful depth. And I've seen some good root cause methodology used in the past. A lot of it tends to be pretty average. The solution from the root cause investigation is generally where you stop. And where you stop asking questions, then that becomes, right, that's the solution. We're going to write a procedure. We're going to add another checklist. We're going to some controls around people. Well, that's not really where it is. The issues lies further afield. So, so from a regulator's perspective, it's really trying to engage with organisations to sort of quell that perception and say to them, look, it's okay to make mistakes, and sort of minor injuries and issues and near misses are part of life and part of work. The challenge is actually identifying them, making people comfortable enough to call them out and say, hey, this nearly happened to me. Let's learn from that and change it. And if things do go wrong and people do lose fingers, that doesn't automatically mean the regulator's going to prosecute you. Prosecution is just one compliance outcome. There are a number of others which we consider, and enforceable undertakings is a good one. And I've been a bit of a sort of heavy influencer in this space. So when I came to the role, there was a misconception that in order to have a enforceable undertaking with the regulator is that you had to be charged with a breach. And I said, no, you don't have to charge. In fact, that's way too far down the line. I said, why don't you come really early and say, we'd like to negotiate? And I said, and we'll have a conversation. And if we can't go down that path, then I'll tell you we can't go down that path, and we'll park it and you'll get prosecuted. But that's because it's really, really serious. But generally, and that was a bit of a light bulb moment for a lot of law firms. And now what we've seen is a huge wave of early conversations from businesses and lawyers saying, we want to enter into an undertaking. And I've said, brilliant, come in, let's have a talk. But don't give me an undertaking that says I'm going to put 5 people through a Cert 4 work health and safety course.
That's incredible.
There's no value in that.
No.
Come back and put something meaningful back into your organization, something that means you're not just compliant because you should have been doing that in the first place, something that takes you to the next level, but is something different, and build in new cultural aspects. And I've encouraged organizations to go and speak to and look at Dave Proven's work and say, right, give me a term about how you're going to declutter all of these meaningless processes, and how are you going to change people's perception about openly volunteering when they've hurt themselves.
Most prosecutions, and even those are, those are not huge numbers, right? I mean, you try to find other ways, right, to engage with industry typically, and but are about duty of care, right? And so ultimately, I was always thinking, Mark, that if you commit to the safety to safety differently thinking, what are you showing other than that you actually care? That you care about how work actually gets done, that you care about the obstacles that are in everyday people's work, everyday people's way for them to get work done, that you care about how they experience their daily work, how they experience the compliance overburden, how they, you can show that care in so many more and better ways than to give them another procedure.
Yeah, exactly. And this is about keeping your workforce safe, healthy, happy, engaged,
informed. Yeah.
And that, in my opinion, and what I'm trying to do in South Australia and influence nationally, is you don't necessarily get that by adding more compliance, more procedures, rules-based outcomes, punishment. If people breach a safety procedure, you're going to get disciplined, sacked, because guess what? They're not going to tell you when to do that.
Exactly.
All these concepts that we've been talking of, you've been talking about for a long time, and all of your books, most of them which are sitting in there, and So in trying to ventilate that and to sort of move or dispel this persona that the regulators are purely just to hit you with a big stick, because we're not. It's about improving safety outcomes.
The next question we'll go back to Martin for. It's in relation to how do regulators find the balance between allowing exposure to risk and building resilience while keeping employees safe? How can regulators communicate better? And is collaboration with locals needed for better messaging?
Yes, I think the key point there is the engagement and education. So we in South Australia, we have a pretty active and strong education arm within our organisation, and they are people who don't have inspectors' powers. So they go into organisations and help people do the right thing. And if there's one part of the agency that I would love to grow, it would be that part of it. The mere fact that people ring us and want to engage is fantastic. So we need to do everything we can to support people. When we do that, we do find things that are wrong in their organisation, things that aren't compliant. But again, the advisors are trusted to manage that risk.
And I think, Martin, that would be true even in your own organisation, right?
Oh, yeah, it is. It is. It's everywhere. So you've got to have a level of tolerance, and I think where that level of tolerance sits in an organisation is really set by the chief executive. It's by people like me as to what you're willing to let your inspectors do and what you're willing to let them say and how you actually want people to comply. And if you take a particularly hard line and prosecute as many people as you can, then the level of voluntary engagement is going to be minimal. People aren't necessarily going to come to you. And it's the same concept as reporting a safety incident on a mine site or in a hospital. If you know you're going to get sacked and no one sees you, you're not going to say anything. Safe business. So we've been really clear about what our enforcement and our engagement policy is. And I've been really vocal at conferences and social media about how we work with people, what we'll do, and trying to push other compliance outcomes such as voluntary undertakings and that sort of thing. Because I've said a number of times publicly that when people are prosecuted for workplace injuries and deaths, generally so far people haven't gone to jail. Few have, but not many, and it's generally a pretty big fine. That doesn't come to me, and it doesn't go to the family. It goes to the government revenue.
Into the black hole.
Into the black hole. So I've said to people, why wouldn't you engage with us early? Craft an undertaking that adds real value to the people in your organisation and the community that you're working in, and invest that money. It's not an easy tick. It's not an easy option to get out of being prosecuted, because the value of an undertaking should mirror what a potential penalty would be. The difference being is you reinvesting it in the areas that get the biggest bang for your buck. And they're the sorts of discussions that we're having now with law firms, like really early and after an incident, and sometimes it's within a couple of days. So for me, I think that's a bit of a positive. But I think going back to that question, I think the leadership sets that level, and whoever sits at the top of the organisation really sets the tone.
Sydney, the next one's for you. Is there a problem of path dependency where once a regulator starts on the more rules track, it's almost impossible to get off?
Not impossible, but there's obviously hysteresis in having made that choice, right? And then that you get sort of momentum. Yeah. So the hysteresis, I mean, it's like a magnet, right? So you point it in a particular direction, it's very difficult to change it. Is I think in part because once a regulator has chosen that route, when do you stop, and what do you do with those that you were still prosecuting and punishing yesterday, right? And no longer today, right? There will be societally a significant sense of unfairness and calls for perhaps even retrospective restitutions or changes in these decisions. I think Martin would be better positioned to comment on this, but I read from what Martin said earlier already that that it's slow and conservative to change these things. But Mark, your reflection on this?
Yeah, it is slow, and work health and safety in particular in Australia is a tripartite arrangement between industry and unions and government. So it does take a long time to turn this ship. The more serious an incident or injury, then the more likely it is that people will look towards prosecution, and particularly when you're looking at workplace fatality. I think any regulator around the country would look at prosecuting fatalities in any event. That said, I did accept an enforceable undertaking from one party in a workplace fatality. So there were two defendants in that case, both government departments, and one pleaded guilty. The other one we accepted an undertaking. So that was the first time an undertaking. I think it was the first time an undertaking has been accepted as part of the fatality investigation. But
it's an interesting reflection on, of course, the outcome bias and cause-consequence equivalence assumptions, right? The idea that if there's fatality, then the breaches must be really, really, really bad, right? Which, of course, in a complex universe is a nonsensical thing to say, right? And it literally is absurd. Right? You cannot say these things. Because really trivial things can lead to really bad outcomes, and really bad things can lead to no outcomes, right? As we all know in complex systems. So it's interesting to see, back to Maggie's question, or not Maggie's question, but the question Maggie voiced about risk appetite, that society's desire to see this match between, if there's a bad consequence, then there have to be bad causes, which need to be punished more harshly than if there are no bad consequences. Whereas the behavior may be either the same or more egregious, you know. So anyway,
you're right. There are all these competing factors, and there's society, and there's government, and there's unions, and there's industry groups, and there's the community expectations of holding people accountable for doing the wrong thing. But then you know, well, what's the wrong thing? Because an example of a few years back, there was a construction worker in Western Australia fell 2 feet off a wooden plank and died. He hit his head for 2 seconds. And you think, I've fallen further than that a number of times. But for him, it was just pure coincidence. He hit his head on a particular rock, and that was it. And then we've had people that have fallen 8 meters through a roof and bounced and walked away. Or we've had people that have been crushed in horrendous ways. And you think, well, are we sensationalizing the way that people die? And that influences the way that we decide an outcome. Because falling 2 feet off a plank isn't as sensational as being crushed.
Martin, how are your fellow work, health and safety regulators or other regulators also coming along on the safety differently journey?
Yeah, so it was a new concept for them. Every year, the heads of workplace safety authorities, which is all my peers around Australia, New Zealand, and I currently chair that group. We have an annual conference for our inspectors. And last year, I suggested that it be focused around safety differently. And Sydney and the team from Griffith Uni came to present on a number of different topics around it. And that was the first time that this had really been ventilated around other jurisdictions. And like any sort of new thing, people sort of grabbed hold of it, and some people instantly got the concepts and said, yeah, this is something that we need to integrate. And then there was the majority that went, wow, what do we do with this? How do we mold this into something that we do as a regulator? Other people sort of said, yeah, I get it, sort of get it, but that really sits in the private sector. And I said, well, no, it doesn't. It's relevant to us as well. We're regulating the private sector. So it is new. And I think some of the concepts, if you've taken some of the concepts out in isolation, have been implemented in different jurisdictions. But like everything in Australia, it's a federated system. So we work collaboratively and share, but we can't influence each other's jurisdiction. So whatever one state and territory wants to do is really up to them.
Right. We might end with two related questions about COVID. How could regulators encourage COVID-safe behaviors in the context of public health and safety by thinking about safety differently, and in particular in relation to the current public health orders in relation to COVID, which are still a legal direction?
It's been an interesting journey as a regulator, sort of influencing some of the discussions. I think because we're looking at workers and workplaces, then really trying to sort of manage those risks and hazards was really difficult in the early stages because we didn't know a huge amount about it. I think there's a lot more leniency now, allowing workers to do the right thing. I suppose the challenge from a regulator is not necessarily around the controls about wearing masks and distancing, because I think that they're fairly embedded in what people do now. And I think the challenge from a safety regulator is this is now quite normal, and there are other risks that emerge from it, particularly around home working.
Yeah.
So an examples being we have people working at home now, and there's a blurring between work and home and work. And is it okay to do a couple of hours and then look after the kids, or is it okay to go make a coffee? What about people who are in abusive relationships and we tell people to work from home and now they're locked in with a partner 24/7 and not just 12 hours a day? And so there's a lot of other issues that have arisen from the COVID situation other than just the distancing controls.
But there's I think that the safety 1, safety 2 flip there, Martin and Maggie, in response to the question would and I'm very conscious at the time, would be very simply be this, and this would be my answer. I think the public discussion, yes, necessarily, but unfortunately is circulating around very safety 1 interventions, constraints, controls. People are the problem. We contain, control, shrink the frame, more compliance, more rules, more enforcement. Instead, what we should be doing is thinking about capacity, the capacity of the immune system of our population here, which means vaccinate, vaccinate, vaccinate. That's the way to increase the capacity to deal with this rather than putting constraints on it. That would be my answer.
Yeah.
Thank you both. Well, thank you again to our speakers and to our audience for your enthusiastic participation, and to the ANZSOG team for coordinating today's webinar.